Well, that's basically what we're sinking our teeth into, enough to take our attention on health matters. I mean, when you look at the fact that it's COVID-19, our doctors, resident doctors are on strike, and also there's cholera also on the front pages this morning. There's enough to, give one concern in the health sector. But to shed a little more light on what the interventions have been since this strike action started, at least since last year, we have with us Honorable Yusuf Sununu, who's a medical doctor himself, and also the Chairman House Committee on Healthcare Services. He's also the former National Secretary General of the Nigerian Medical Association. You're welcome to Sunrise Early this morning.
Thank you, ma'am.
Honorable, this is not the first time you're appearing on this program as a result of this particular strike. I remember that the last time you were here, you were very optimistic that the problems and the challenges which were confronting NARD at that time were going to be amicably resolved. What has gone wrong? Why have the doctors had cause to go on strike again? Are you aware?
Well, thank you very much. I'm aware that the doctors are on strike. And the House is on recess. The Speaker just directed me a few days ago that we should have to come back and see how the committee will intervene to fast-track the resolving of the matters. Where are we where we are? I always keep on saying it's lack of sincerity, openness, and taking things serious. And also certain miscommunication within the system.
Now, on the part of who? Lack of sincerity on whose part? It's very important to establish that.
Yes, on the part of on the part especially of the government part, because sincerity means that whenever you are appending your signature, you must append to what you are sure really you are going to act on it. And also there is miscommunication on the part of the Nigerian Association of Resident Doctors on their own part, of which all I'm going to explain.
Okay.
But the part of the government I've mentioned, before you go into any negotiation, negotiation is give and take. Everybody must move from his own initial step. You must do your own need assessment to know that before you can append signature, definitely you can afford to pay what is required for you. It is always not good that you go back and do your need assessment or you do introspective study of what you have signed, and then you find that you cannot afford to pay it. And then you cannot call those who have appended signature along with you to come and discuss, look, this thing is too much on our own part, we cannot do. Can we negotiate so that we can have something like this? I must also commend the Labour Ministry for what they are doing now. And that's why for a very long time they have been negotiating to agree on an actual hazard allowance that the government can pay, rather than that version of signing an MOU that definitely you don't have the capacity or you have not assessed your capacity to implement it. You understand? So that's this thing. So that's why a lot of issues we are discussing, we are going forth back and front. And then the other issue of insincerity is lack of taking it serious. Taking it serious in the sense that if you agree on something, there must be a specific desk officer that is assigned to monitor and track the progress using a checklist that from time to time look, this is where we are today, this is where we are going to be tomorrow, and this is the final end. When you don't track your agreement in such fashion, then it becomes seriously an issue. While as National Assembly, we tend definitely to track it closely. But you find that at a certain stage, some do not take it serious. So that's why I said there is insincerity on that, in that regard. Now, on the issue of the NARD that I said miscommunication, when you look at the major issue now, it's the migration of resident doctors who are on GIPMIS to IPPIS salary scale, you understand, structure. Now, here we are. Some hospitals, because of three factors. One, the fact that there is a brain drain out of this country. The fact that COVID has gone a lot of people. The fact that many doctors are also taking, it's part of the brain drain going out of the country, and some are also trying to move to other ventures when they find that there is more to also do outside medical practice. We are losing so much doctors. So that left a lot of vacancy in our hospital that is enough to stop or bring a serious impediment to service delivery in the hospital. So hospitals now devise a means of filling in the gap. And this filling in the gap, as by hospitals, from what I've this are two ways. One, either employing doctors as locum doctors, that's on temporary basis until they are having the clearance and the waiver from the head of service, budget office, and then the federal character to employ, so that they will give them now the right of first refusal. So they will be the first line to be absorbed into mainstream civil service. Now others go without waiver and issue out employment. This happened in UCH Ibadan, UPTH, and then without waiver. And now all of a sudden, because of the strike, they are paying them out of their IGR, but they have given them a letter of appointment, not on temporary basis as permanent staff or as a resident doctors. I hope you are getting me. We have to understand the two. So now, the strike came, their resources through IGRs falls. The money in give means because of the need to migrate money or to source money for COVID and other health intervention and non-COVID health intervention. Some resources are mopped up, which is understandable. All over it happens like that. So the money in give means and the IGR falls. And those doctors that they have employed, they cannot pay them regularly. So that's this. Then the third one are those that have secured waiver and they were given right to employ. Now, when we had the last meeting with them, the major issue is migrating them to IPPIs, which it means that they are now permanent and pensionable. Now, this is where we have an issue. Those who are on locum, the head of service directed that they should write waiver so that they can be given waiver to employ. This happened in Federal Medical Center, Yola, and other hospitals that were given waiver, and they have gone ahead to absorb the first set of doctors that are on their locum to IPPRs. They have migrated them. Even just 2 days ago when I spoke to the CMD, he told me that they are making the second and final phase of migration. You understand? Now, for those who are on locum, they are also expected to write to the head of service to get waiver. And the head of service said she's still waiting once ever that this issue fast-tracked so that they can get waiver. Now, where we have the problem are those who are given permanent appointment and then they are not, they haven't got the waiver of the office of the head of service to get them employed. So now for you to get migrated to IPPIS, definitely you have to show 3 documents. You have to show to the staff of IPPIS evidence that you're having a waiver from the head of service. You must show that the evidence you have a waiver from the budget office of the federation. You must also you must show also the certificate of compliance from Federal Character Commission. So when you have these 3 items, you now be migrated to IPPIS platform.
We also look at federal character in the employment of doctors.
It's part of the civil service. Let me tell you, if you didn't look at the federal character, for example, now, my state will say, the Federal Medical Center will say it will only employ doctors from Kebbi State or doctors from Sokoto State. You understand? So what of other doctors? Are they not? Don't they have right to be employed? So that's why federal character also comes in.
No,
you understand? And it's also part of the regulation of the constitutional provision of the federation that for every employment of government, federal character must be reflected.
I asked that question because I wonder whether we have the luxury of being able to determine federal character in the employment of doctors. I mean, in the place whereby we're experiencing a dearth of some sort and a brain drain of doctors, do we really have the luxury to say if you're not from here or if we don't fill all of these slots, we will not employ these doctors?
No, you see what I said, certificate of compliance.
Yes.
Certificate of compliance. Definitely, you see, we cannot just overlook the provision, constitutional provision. I'm a lawmaker and I will not advocate for law breaking. You understand? For example now, if only one person from KB apply in UCH Ibadan for a position and he's denied, I'll take it up because I know by federal character, he is supposed to be given a slot.
Yes, but what if he's not qualified, for instance? Or is there any because I want to imagine.
Let me tell you one thing.
Yes.
As far as Nigeria is concerned,
yes,
each and every trained doctor in Nigeria who trained in Nigeria is qualified to be employed. I stand by that, and that's the rule. And for anybody who trained outside Nigeria, after passing the necessary mandatory examination conducted by Medical and Dental Council of Nigeria, is also qualified to be appointed in Nigeria.
It doesn't matter what sort of... Anyways, that is...
So as I was explaining...
It's very important, I mean, that is established, because I'm sure some people wonder about standards, for instance, if medical training across board in all our tertiary institutions, wherever doctors are being trained, if all of our trainings are standardized in such a way that we can vouch for if a doctor is produced in Kaduna is the same quality as a doctor who is produced anywhere else in the country.
That I can assure you of that, and that's why we have the Medical and Dental Council of Nigeria. And you must know that the conduct of medical examination is both internal and external. For example, when I was writing my Part 2 final at University of Maiduguri Teaching Hospital, my external examiner was from Ilorin. Some came from Ibadan, some came from DC. You understand? And then when I went for my postgraduate college, the exam is the same. Our center is in Ibadan. And then your examiner, your teacher, the trainer who trained you in your own institution, will never have the opportunity to examine you in your own Part 1 or Part 2 examination. You understand? This is to maintain standard so that everybody is trained equally. But training equally does not mean that you have equal skills. The ability to acquire skill may be innate and differ from one person to another. So that's it. But in terms of standards and ability to perform basic, it's not assumption. Everybody has that equal exposure.
Interesting.
Yeah.
Okay, I think I was something, but we deviate now. We're talking about the conditions that doctors.
So you understand. So this is where we are now in terms of this. Now the other issue that also we have discussed is the issue of claim for insurance claim by those who lost their loved ones and families while in active service providing healthcare, especially in COVID-19 now, which we also have agreed. And even about 2-3 days ago, I had a discussion with the head of service. And what she said, the agreement was that hospitals should now write a claim so that the family can be distant. She cannot process anything without initiation. And the initiation of that process starts with hospitals. So the hospital will now write to the head of service, and the head of service will process it. Already the money is with insurance companies. You understand? But what is happening now and what we are finding, especially from the head of service on this thing, is that no hospital have ever written to claim. And she has also instructed the Nigerian Association of Resident Doctors to go and get the claim from those hospitals so it can be transmitted. You understand? So all this, the other issue is that we have now, which I always try to explain to the NARD, is the fact that there are claims from state. We have a state that is owing almost 20 months' salary, which is uncalled for, and some 10 months' salary. And then for this, luckily for us, even yesterday, we have a lot of this, and NARD will agree that I've contacted them. The Governors Forum, this thing, and then the state governor, my own state governor, His Excellency Alhaji Atiku, Senator Atiku Bagudu, called me yesterday and then tried to verify what are the issues. And I've explained all the in and out of the whole crisis that involved the state. And then his assurance is that they are having an emergency meeting to address this issue so that we can now have a holistic approach. While the federal government is trying to address issues that relate to doctors in the federal services, the state governors, state governors are also working hand in hand to address the issues that has to do with state. And though for those states, for the state doctors, some of the issues are the non-implementation of the adjusted medical salary scale, which is the new, is the basic salary scale that has been improved, open, in order to address the issue of brain disease. It's almost 4 or 5 years now, but a lot of states, I think it's only 6 states that have so far implemented, of which my state is inclusive. My state have already implemented that, probably because we always have interaction with the governor and his wife to see how we can move the healthcare forward. And that has really facilitated it. So now out of 36 states, you have only 36 states. That is not good for us. So that is also one of the problems. The other issue that also affects the state is the domestication of medical residency training funding. So
the grievances,
yes.
Honorable, the grievances from what you have stated are genuine. Is that correct?
Yes, they are joining, but what I don't want to say, and this is what he's saying. So people say nothing is done. And I have it over time in many sessions. For somebody to say nothing is done, I quite disagree with that. Because I have reason to prove that something is being done. And something has been done also.
So why is it taking, because that's a big question for the doctors. They're unable to say, look, it's been over 100 days. It's like 115 days since we since we suspended our strike action in good faith. Why does it take so long?
Because still going back to my initial response, when I told you that there is insincerity and taking things for granted. Let me tell you, an average thing, what I observe is that if not that we are giving them pressure from the National Assembly, sometimes immediately after an agreement is signed, it is dumped. You only try to dust it when there is notice of strike or when you have that next meeting is coming. You understand? So that is the issue we have. So I think while the Ministry of Labour is doing a lot, I have to say it, the Ministry of Health needs to sit up so that agreements will be taken serious. I didn't say that they are not doing. It must be taken. They must have an assigned desk officer that will be responsible in tracking all the agreement with unions so that we can listen. We must agree that health is an essential services. And therefore, whosoever is given that responsibility must see it as such and then act with it. For example, now, look at it. Because it is essential services, everybody that had the closing session of the House of Representatives, Speaker made it clear. The issue of recess is for committees to go and realize when and with their family and take care of their family so that when they come back, they can channel their energy towards moving their destiny. But it made it clear, health is exclusive. Health is exclusive. And even when he came back, or when he was going out of chamber, we stood to see him. He said, Honorable Sununu, yours is exclusive. You must act as at when due. And immediately it happened, he has directed me, I'm here. And today we are meeting all the stakeholders. We have already sent out the invitation to head of service. We have sent it to the Ministry of Health, Budget Office, IPPIS, NARD, NMA, and all major stakeholders so that we can come together and see. Because I'm really worried. Worried in the fact that if you look at the situation in the country now, inflation is on the high side. Two, there is an issue of insecurity. As you mentioned, there is third wave. Outbreak is coming. All these are challenges toward. And majorly fifth one is almost, before we used to say 75%, now almost getting to 80% of healthcare procurement is out of pocket. Now an average person that cannot get, is not sure of getting at least an average of $1 per day. Is facing 5 these challenges. How do you think now, and why he now is now going to get a little subsidy in the public hospital are shut down? Where do you want him to go? So that's why we all have to think and put our country first and see how we can work together for not to shoot its force, and then for the executive and other arms of government to take it serious so that we can together work. I will therefore have to appeal on NARD. That while we agree that things has gone wrong, and there is this now a collective desire to see that we have moved forward. They should sheath their sword. Let's come to the round table, address issues, and then wherever we think that this thing. And then finally, I must agree with head of service, her insistence, that all those that are responsible in the mainstream civil service of putting us where we are need to be sanctioned. And this we have agreed, and I have also told the permanent secretaries, let them go and do an inward retrospective review. Who are the people that will just go without following due processes of civil service, offer employment? You know that you don't have the powers to do that. And you do that, and somebody is serving your hospital for 6 years, for 6 months, 7 months, 4 months, 5 months. You cannot pay him. And you cannot get him absorbed because you didn't follow the due process. We are all colleagues. Some of them are even there for the finance of CMDs. They have worked with them and helped them to be in position.
Let me quickly flip this to Lagos. I understand my colleague has questions for you. Ayo.
Well, thank you, Mokwe. Honorable, one question that I just have is, most of the issues that have been raised by the NARD is around money. And quite a lot of it also, a quite significant number of those issues revolve around infrastructure funding. Salaries is about funding. And if you look at the budget, you know, the 2021 budget for health, for instance, is less than 5%. And many wonder, is there anything the National Assembly could have done about that? We know that sometimes the National Assembly could raise, the funding of any particular sector if they feel it is inadequate based on their own oversight functions in the previous year. Is there anything the National Assembly could have done or could still do to maybe, if money is the issue, intervene?
Well, the National Assembly is doing a lot and will continue to do a lot. Let me say, we have done it before. If you look at the medical residency training funding that was in the budget in 2020, it didn't come from the executive. It was introduced into the budget so as to solve the problem by the National Assembly. And then when we came for the 2021 budget, that was not also included by the executive. So the National Assembly, if you look at the line 3 of the observation, item 3 of observation of the NARD communique that led to this strike, you find that they have appreciated Mr. Speaker for insisting that even in our supplementary budget, the residency funding and other allowances for healthcare workers in Nigeria be included in the supplementary budget. And that is when we have a collective stakeholders meeting headed by Mr. Speaker, and that is when now it was agreed and the finance made it through a service-wide board and included the salaries and arrears of the healthcare practitioners in the country. And where we have the issue is that, and I even explained that to the NARD, the supplementary budget that came, it came up with a proposal, and that proposal also came along with it a request for a loan to back or to back the budget. Now, the budget has been approved and assented to Mr. President. The loan has also been approved by National Assembly. So I told him that definitely, even if you are going to go into your own a local bank, it takes you time for you to. The delay we had in getting that money released is that the money has to be sourced. And once it is sourced, the budget director, budget
Honorable, that is noted. Clear. You've highlighted item, just 1 second, Honorable. Just 1 second, Honorable. You highlighted item 3 on that list that commended the House of Representatives, for the inclusion in the supplementary budget. But if you also look at item 14, it bemoans something that you have also mentioned here this morning, which is that we have a manpower shortage. And I'm almost certain that the executive will tell you the reason we can't do this is because we do not have enough funds. Even the ones that we have that have worked for us, we've not been able to pay, whether at the federal level or at the state level. That's why I'm asking if there is anything the National Assembly could have done to help with enough funds to take care of both man and machines in the health sector.
You see, the issue I told you, we have to be frank. The issue was that there is the problem in terms of communications and taking things serious, of which even the NARD is aware of that. What I mean by that is those who are not paid, like UCH and UPTH, is the fact that they have employed without following the due process of the federal government. And then therefore the Office of the Head of Service says you cannot come to the civil service through the back door. Writing must be done. And the essence of the meeting today is to find that how are we going to do the right thing? How can we fast track it? For that one, they are not saying that there was no budget, no fund for that. The issue and the argument is, how did you enter the civil service? You understand? And most of these MDs try to justify that they have done that. And I think the major issues that the CMDs are given, which is also quite true, is that the processing of waiver is cumbersome, and it's too stressful, and it takes longer time to be completed. For example, now, if a hospital A wanted to acquire a waiver for it to employ the necessary staff that left the civil service so that it can be replaced, the waiver may take them more than 6 months to get approval. So many of them have confirmed that. And I think our duty today in our meeting is to see how can we fast track getting the waiver so that to avoid CMDs going ahead to recruit without following the due process. And for those who are appointed based on locum, those ones are doing it based on their resources through IGR, of which I think is also a stopgap to improve the services delivery in the country. But all these are not necessary when we realize that we are facing serious challenge. And what is that challenge? I've made it clear here that what we have 2 years back was a brain drain. And what we have now may be a brainstorm. For the fact that There are a lot of vacancies world over now due to COVID that have done so much mutilation to healthcare services delivery world over. And then, because of that vacancy, countries are now looking. They are now going to countries with resilient healthcare structure in terms of human resources for health, of which Nigeria is identified to be one, that we can work under whatever circumstances we find ourselves, and therefore they are coming. And they are coming with a decent. You see, for example, let's take Saudi Arabia, for example, where a lot of doctors have gone, and then UK. For Saudi Arabia, they have lessened their visa processing for doctors and other healthcare workers from Nigeria so that they can go there. And then they also give us a specialist. They allowed you to negotiate your own wages. And you see people negotiating a pay of almost 5,000 US dollars, 6,000 US dollars per month. You understand? And with little, and they're also giving them space to have free education for the spouses and 2 children. So you see, anybody that has this offer will move. So I think it is also time for us now to look back. What was the consequences of that? The consequences of that is a weakening healthcare delivery services in Nigeria, poor accessibility, and then multiple complications.
Honorable, let me quickly ask you this. You have commended the Ministry of Labour for the steps that they have taken so far. But in recent times, they've asked the doctors to resume. They've said they're going to start their no work, no pay regime today. They did not see the doctors at work because they have declared the strike illegal. They've told them that there is a court order saying that the strike is illegal. Are you happy so far with the back and forth that has happened since the NARD announces their last strike, and what government's response has been to it?
Well, you see, as far as I'm concerned, as a lawmaker, I'm not in any way bothered about such kind of this thing. We have a situation whereby, why would I in a meeting, doctors were dismissed from service. You understand? But as National Assembly, we put the national interest first. And we insisted, I will mention it, that even one of the, I have to call in I have to put on speakerphone, please withdraw the statement that so is to allow us to move forward so that we can resolve this issue. And that statement was withdrawn. And then the particular ARD branch agreed. And we have continued. And today, even just 2 days ago, I must thank them. I was given a standing ovation for trying to come together and solve out that problems. You understand? So the Minister of Labour probably depend on any one of these international labour organization law to say what he has said, but does not mean that we cannot look at that will stop us from moving forward. You understand? While it's there, when we reach the bridge, we sit down, we'll agree. The NARD will now look at the sincerity of government, and then where we think that that's miscommunication. Because what they told me from the information they gave me, in terms of migration, they have about 10 hospitals. But from my findings, 6 of those hospitals weren't correct. And I've also communicated back to NARD. So these are the fact that today we have invited all those hospitals. Come, why did you put us where we are? They will now explain, and that will be there. And then the health observability will provide us with a solution. The ministry is there to fast track the implementation. So I am sure if we have gone to that lane, the Minister of Labour definitely he will have a cause to also look at it. Meanwhile, he's also a medical practitioner.
Well, we hope that would count for something when that meeting eventually holds today. We have to thank you so much for sharing your thoughts with us this morning and for the efforts that you have put in into resolving this impasse so far. Honorable Yusuf Sonono is a medical doctor and the Chairman House Committee on Healthcare Services. Thank you for coming on Sunrise Daily this morning.
Thank you, ma'am.
We'll take a break at this moment and we'll come back to continue with the issues when we return from this break. Please stay with us.